Nowadays, most IVF facilities propose embryo biopsy or PGD for all embryos. They claim this will boost conception rates and decrease miscarriage rates, yet both are untrue. PGD does well to bamboozle patients because doctors can use fancy genetic words that neither they nor the patient comprehend, making them appear impressive and scientific. They promote PGD by claiming that genetic analysis will help us choose the best embryos, increasing your chances of pregnancy. This makes sense as patients don't understand genetics. Who wants to transplant a genetically defective embryo? Shouldn't the embryo be tested for genetic abnormalities before transfer? Makes sense that this will boost success rates. Even if it's intuitive and reasonable, it may not work in practice. Many studies have shown that PGD does not enhance pregnancy rates. Despite appearances, embryo implantation is unrelated to genetic abnormality, and even defective embryos implant. Because embryos can implant, genetically defective kids have birth problems. Genetic testing is unfamiliar to many IVF doctors, but they want to upsell and know that the more tests they give the patient, the more they may make. Worse, they mislead patients who have failed an IVF cycle that PGD will improve their next cycle, which is false. First principles reasoning will explain why. All regular PGD testing does is count embryo chromosomes. Doctors love creating new acronyms to confound people, like PGTA for aneuploidy screening. Even if an embryo has 23 pairs of chromosomes, euploid, it doesn't indicate its genes are normal because it has 30,000 genes. This is why a chromosomally normal embryo, as verified by PGD, may fail to implant. It may have a fatal genetic flaw that causes it to arrest. The assertion that it reduces miscarriage risk? Yes, some chromosomally defective embryos have a higher chance of miscarriage, but this doesn't encompass all the possible causes, so you could miscarry after PGD with a normal embryo. PGD reduces the risk of a baby having the defect you screened for. Unfortunately, we can only screen a few genetic abnormalities. We only screen for chromosomal aneuploidies, monosomies and trisomies, not all genetic disorders. This is why a patient who gets pregnant following PGD normal embryo transfer can miscarry. Even if she doesn't, she'll still have to do all the routine prenatal diagnostic tests that any other woman who gets pregnant, in her bedroom or after regular IVF, needs to do because PGD genetic tests only analyze a few cells, which isn't enough to make sure the baby is normal. This means that whether you do a PGD or not, you will still have to do the same testing during pregnancy, so there's no point in making patients waste their money on an expensive, complex, and error-prone test. Physicians will continue to employ PGD testing since it makes them more money and is easier to persuade patients to do as they are told because they don't know better. We are still far from developing a test to detect which embryo will produce a healthy baby, the holy grail of IVF. Don't squander your money on PGD. It will create anguish, heartburn, and grief when the cycle fails or you miscarry, and it will make it hard to trust your IVF doctor. Need help getting pregnant? Please send us your medical by filling out our free second opinion form, so that we can help. For further queries, WhatsApp at 9867441589.